So there's just a bit of a scar there, Andy. Anything that I need to know?
I had a mole removed, so
Okay.
that was last year.
Last year, okay.
And that show my all, I had that done in December, so
Okay.
be just a little bit careful around
Yeah,
that as well.
we'll be careful around that.
Okay.
You might have heard of scar work, scar therapy. Any incision into the superficial layers, no matter how deep or superficial, there's going to be some restriction there in the fascia. So we're going to take a look while we cup and do the dynamic cupping as to what's actually happening with the fascia. So let's get some wax on there first. This is the fascial release wax, which is usable in the summer. In the winter, it's fairly useless. It's very, very dry kind of wax. We want as little on there as possible, ideally. And keep in mind, with cups, we're not confined to the deep tissue kind of areas and to avoid bony prominences. Because it's negative pressure, we can go over the spinous processes, we can go over PSIS and the iliac crest. So a good covering of wax. I'm going to start with one of the bigger cups. I'm going to go with one pump to start with, just to gauge Annie's reaction. She's never had cupping before, so let's see how it goes. One pump, and then we're going to move. We don't want to hold that cup in position for too long because it's going to give us the red mark. How's that feeling, Andy? Okay?
Yeah, it's fine, yeah, it's comfortable.
Good. So which direction can we go? Where can we go? How fast? They're all the questions that I'm going to answer. We're going to start longitudinally. It's over that scar. I'm going to now get down and have a little look. And actually, if you come in and have a look there, you can see the scar in there, and the fascia is actually looking pretty good, because sometimes what you'll see is a little divot, almost like lips in there, but we haven't got anything like that going on. So that's all good, but worth a look. So let's move along before we end up with a mark. And when you are moving the cup, I'd suggest getting yourself down to a lower level so that you actually can see any restrictions. And if you do, just point them out to me and then we'll cover that when we get to it.
Are you applying force downward on the cups, or are you just letting it do?
If anything, I'm lifting up a bit.
Oh, right, okay.
Yeah, I'm trying to lift those tissues away from the structures beneath them. And then now I'm going to start to do a little bit of transverse as well. There's no rhyme or reason as to which way you do it, just don't do the same thing for too long. You can see here I'm going over the ribs, which is fine. Still feel okay, Andy?
Yeah, still comfortable.
Yeah. Good. Might get a bit ticklish as we get down to the lower ribs, QL kind of area. And now we're going to go over the spinous processes as well, which is why I really like dynamic cupping, because where else can you get away with this apart from skin rolling? You'll find you're fighting with it as it wants to go left, right. Try and keep it stable. I'm just trying to push through. So you can see some erythema starting up there. That doesn't indicate that we need to stop really right now. We do need to be careful today because we're going to be doing a lot of cupping in different areas, so don't overdo it. And let's keep that going. And as I was going there, I lost the pressure in this cup. Andy said that was fine. Erythema was not too bad, so let's try 1.5 pumps and see how we go. Maybe start with the sacrum this time. 1.5. If it starts to feel sore, Andy, you let me know, okay?
Yeah.
So just like with deeper massage strokes, the deeper we go, the slower we go. And I'm not going to force it through that little bit of restriction there. Just going to slowly work with it. You can see the erythema is quite a bit more this time. So try and keep it moving. And now the erector spinae really quite red, so let's move over to the ribs. And the last thing that I'm going to show you with dynamic cupping is a bit of torsion. So thinking about that fascia under the skin. We've got a lovely colour now. So what we're going to do as we go, we're going to twist the cup. Come back. Twist the cup. Still feeling okay, Andy?
Yeah, feels fine.
Good. Some people might be jumping off the couch. It's completely different reactions.
If it was any tighter, I would be, yeah, that's 30, but it's comfortable at the minute.
Yeah, I'd say 1 pump is the typical kind of
Yeah.
negative pressure for dynamic cupping. 2 pumps is going to be the top end. And it's losing the pressure as it goes. So some erythema there, a couple of marks where I stopped in certain places. That for me would indicate, just like with massage, that it's time now to move along to the next technique. So you're probably not going to spend too long doing this depending on your individual reactions. To recap then, what I'd like to see is 1 pump, some observation from you, having a look at actually what's going on under the cup, taking your time. Work over the spinous processes, trying to unlearn those massage habits, and then down into the ribs as well. And a useful thing for you, being the recipient, is to know how it feels. With me, particularly, you put one on my sacrum, I can just feel my soul leave my body in the nicest possible way. It's just lovely. And that's obviously anteriorly tilt the pelvis. The tissue in there becomes short and tight, and this just stretches it out in a way that I struggle to get anywhere else. Try a bit of the torsion as well.
How often do you use this in your clinic?
It depends, really. With some people, a lot. Some people react really well to it. They actually like it, and it's effective. Other people completely hate it, and they say, yeah, that time you used it, please don't ever do that again. So it depends on the person, depends on how effective it's been. There are some returning clients that it's just maintenance kind of stuff. You're in a bit of a routine with them, where I know that I'm always going to use it on their IT band because it works well, gives them the relief they need, on their thoracolumbar fascia, for the reason that I would benefit from it with the anterior tilt of the pelvis and the restriction shortening in that tissue. But yeah, quite regularly. I think it's my most regularly used alternative practice.
Yeah.
That makes sense. About massage and MT mobilisation.